If a nursing home tells you that your loved one's bed sores are just part of getting older or normal for their age, they are probably not telling you the truth. Now, in the next few minutes, I'm going to explain to you why bed sores are almost always due to unrelieved pressure, and I'm going to show you exactly what proper care looks like so you'll know if your family member is getting the attention they deserve. This information could literally save their life. My name is David Terry. I'm the founder and owner of the Terry Law Firm, and for nearly 25 years, I've been fighting for families whose loved ones developed preventable bed sores in nursing homes. I've heard every excuse the facilities give, and today I'm going to debunk what I believe is the biggest lie of all, that bed sores are inevitable as people age. Here's the truth. Bed sores that develop at nursing homes are almost always preventable. When bed sores occur, it's usually because of a systemic failure at the facility where someone, or more likely several someones, weren't doing their job. So let me explain. First, let's talk about what bed sores actually are. Medically, they're called decubitus ulcers. More commonly, you'll hear people call them pressure ulcers or pressure sores or pressure injuries. There's multiple names for the same thing. I typically refer to them as pressure sores because I think that's the best description of what causes them. But for today, we're just going to refer to them as bed sores because that's what most people outside the medical or legal industries call them. So simply put, bed sores developed when sustained pressure cuts off the blood flow supply to the skin and the underlying tissue. So think of it this way. If you sit in one position too long, you just naturally shift your weight because you start to feel uncomfortable. That's your body protecting itself. But elderly or immobilized nursing home residents can't always move on their own, and their skin is probably more fragile than yours. However, and this is crucial, bed sores don't just happen because someone is old. They happen because proper care protocols aren't being followed. Now, we'll talk about protocols here in a minute. Bed sores develop in 4 stages, and understanding these stages helps us understand why they're mostly preventable. So let's start at stage 1. A stage 1 bed sore looks kind of like a red area, and it just doesn't go away when the pressure is removed. At this stage, it's completely reversible with proper and easy care. Stage 2. A stage 2 bed sore shows broken skin or shallow wounds, and these are still very treatable with immediate attention. Stage 3. A stage 3 bed sore is much more serious. Now the wound is going deeper into the tissue, creating a crater-like wound. Now at this point, there's no longer an easy fix. This has now become a serious problem. Stage 4. A stage 4 bed sore is the most severe. When a bed sore reaches stage 4, you can quite literally look into the bed sore wound and see bone, muscle, or tendons. These can be life-threatening and lead to sepsis or death. So here's the key point. It takes time for a bed sore to progress through these 4 stages. Stage 1 doesn't become stage 4 overnight. A properly staffed facility with attentive caregivers should catch and treat bed sores long before they become dangerous. But sadly, too often they just don't. And just as often, many nursing homes will try to hide the bed sore from the family or lie to them and say, well, it was unpreventable, and that's just the normal aging process. Now, let me tell you why I believe most bed sores are preventable. Because when you understand this, you'll know whether your loved one is getting proper care. So prevention method number 1, regular repositioning. Residents who can't move themselves should be repositioned every 2 hours without exception, sometimes every 1 hour. Now, this prevents sustained pressure on any one area. So remember earlier, I mentioned what you and I do when we sit for too long. We reposition ourselves. But for the elderly or immobilized residents who are physically unable to reposition themselves, they simply can't do that. And they are dependent on others to reposition them. When they are residents in a nursing home, it's the nursing home employees who are responsible for repositioning the residents. And when it's not done, bed sores will develop. Now, good facilities will have turning schedules posted at each bed, and staff will actually follow them. And importantly, good facilities will document that repositioning is done when it's done. Prevention measure number 2, proper skin inspection. Staff members should check the resident's skin daily, looking for early warning signs like redness or irritation. And if caught early, as I mentioned, bed sores can be prevented entirely and pretty easily. Proper nutrition helps skin stay healthy and heal faster. Dehydration makes skin more fragile and prone to breakdown. Now, you remember those posters we all saw in our grade school cafeterias that said, "You are what you eat"? Well, I'm telling you, that's 100% true, and it's especially true for the elderly. Keeping skin clean and dry. Moisture from incontinence accelerates skin breakdown. Residents who suffer incontinence must be cleaned immediately and kept dry. Otherwise, the urine and the feces will act as a corrosive agent and they will cause skin breakdown. Have you ever seen how fast a diaper rash develops on an infant? Well, the same concept applies here for the elderly. So what's the bottom line? Every single one of these prevention measures is basic nursing care. When facilities follow these simple protocols, the chance of a bed sore developing decreases markedly. So if bed sores are preventable, why do they still happen? The answer isn't pretty, but you need to know it. In my experience in handling more nursing home bed sore cases than I can remember, here are the top 4 reasons why bed sores happen. Number 1, understaffing. When there aren't enough nurses and aides, residents just don't get repositioned every 2 hours. They don't get their proper skin checks, and they don't get cleaned promptly after incontinence. Think about it. When a CNA is responsible for 20 residents and 13 of them need to be repositioned every 2 hours, but all 20 have different needs, there just isn't time for the aide to meet the need of all those residents. There just isn't time. And when employees are scrambling just to keep all the plates spinning, these easy things get forgotten or just not done. And those things that require immediate attention, like getting cleaned after incontinence, those things get delayed. And it's these things that add up to bed sores. Second, poor training. Some facilities don't properly train staff on bed sore prevention or the recognition of early warning signs. Sometimes, by no fault of their own, some nursing home employees just don't have the competency to know what to look for or even to know to look for something. That's the fault of those who are in charge of the facility. Number 3, cost cutting. Some facilities try to save money by reducing staff or using cheaper equipment instead of pressure relieving devices. The facilities that use this model are often cost cutting in multiple areas. Poor food quality, old equipment, old, thin, and poor quality linens, you name it. And in facilities like this, it's the ownership that's the problem, because these cost-cutting measures are on purpose, and that purpose is to increase owner wealth. And sadly, that comes at the expense of resident care. Number 4, neglect. Sometimes staff simply aren't paying attention or don't care enough to follow protocols. I try generally not to be too hard on the lower level staff at nursing homes because the deck is often stacked against them due to the reasons that we just talked about. But in virtually every case I've handled, there's always 1 or 2 bad apples. And those are employees who just simply don't care. They're mean or they're rough with residents, they're unkind to them, and they spend their time on their phones when they should be providing patient care. And when confronted by a resident or a family member, they're dismissive or confrontational. In most bedsore cases I've handled, there are few, if any, records that show consistent repositioning. Every once in a while, we find repositioning schedules that are perfect. In fact, too perfect. It's hard to reconcile perfect documentation on repositioning with a large, gaping stage 4 infected bedsore. The bottom line there is that falsifying records simply does happen. I wouldn't say it's common, but it's certainly not unheard of. Now, none of these reasons have anything to do with your loved one's age. They have everything to do with the quality of care being provided. So here's what you need to look for during visits. A visual inspection. Check the common areas where bed sores developed. Check their tailbone, hips, heels, and shoulder blades. Look for any redness, discoloration, or broken skin. Number 2, ask direct questions. How often is my mom or my dad or my spouse? How often are they repositioned? Can I see their nursing schedule or their turning schedule? I want to see that. And what type of mattress is being used? And who checks their skin? And how often? And next, I want you to document everything. If you see concerning areas, take photographs and videos. Write down the names of those who are most often assigned to your loved one's care. That helps your lawyer. Don't accept vague answers from the staff. If the staff say things like, well, we turn residents as needed, or it's hard to prevent bed sores at her age, that's a red flag. Proper care has specific, measurable protocols. If you discover your loved one has bed sores, first, ensure that they're getting immediate medical treatment. Bed sores can become infected and life-threatening, and you don't want that to happen. Second, you're going to want to document everything. Like I said before, you'll want to document the size, location, and what stage the bed sore is. And the best way for you to do that is to take photographs and videos. Third, demand to know how this happened and what's being done to prevent it from getting worse. Now let me qualify demand. Do not yell, do not threaten, do not be abusive. That's the worst thing you can do. You can demand answers while still being polite and respectful. Be firm and direct, not abusive and angry. Fourth, report your concerns to the facility administrator and the director of nursing. If your concerns are not addressed, you then may want to file a complaint with the government agency in your state that is responsible for nursing homes. And finally, consider legal action. Bed sores often indicate systemic problems with care, and facilities need to be held accountable. And that's what we do at the Terry Law Firm. We pursue justice for nursing home residents, and a big part of that is holding these facilities accountable for the bad care that they provide. Don't let anyone tell you that bed sores are just a part of aging or that's a natural progression. They're not. Bed sores are a sign of poor care, often systemic poor care, and your loved one deserves better. If this video helped you to understand the truth about bed sores, please share it with other families who need this information. I'd also ask that you subscribe to our channel for more tips on protecting your loved ones in nursing homes. And remember, finally, bed sores are preventable. When they occur, someone failed to do their jobs. Hold them accountable.